Patients on a converter platform in the German Bight having a heart attack require and have the right to the same kind of medical treatment as those on shore. There will of course always be highly qualified paramedics on site with the expertise to conduct basic life-saving measures, but they need more. They need an emergency medicine specialist. They need access to a control room that receives their emergency call and arranges all the necessary steps.
Ja, habe ich verstanden.
Yes, understood. I'll send a helicopter and call the telemedicine network. Hello, this is the telemedicine network control room, Clinic Oldenburg. Dr. Overhoy. Yeah, hello, doctor. This is the paramedic from the platform.
Bis der Hubschrauber am Notfallort ein.
Until the helicopter arrives at the scene of emergency, the telemedicine network will assist the paramedic on site, but diagnostic analysis and consideration of differential diagnostics are subject to the physician. That's a typical posterior myocardial infarction right here, no two ways about it. All right, let me just pass that on to the platform. So, we've just discussed it and would like to proceed according to the algorithm. Please administer 500 milligrams of aspirin, 5,000 heparin, and 3 milligrams of morphine, all intravenously. Time will pass until the helicopter with the emergency medicine specialist arrives. Those platforms out there can be over 60 miles away from the mainland, and this time has to be bridged somehow. Good, the saturation is in good order. I don't know whether he's dyspneic, but look at his blood pressure. We need to do something there.
Wir haben heute die Möglichkeit, und das ist wirklich neu.
Nowadays we have the possibility, and this is indeed a novelty, to transmit live medical data to a maximum care hospital using small multifunctional devices, enabling us to consult medical specialists for guidance that may not even be on site. The device could be operated by a medical amateur who then asks an emergency medicine specialist for assistance.
Assistenten letztendlich Hilfe fragen.
Are his values okay? ST segment elevation, myocardial infarction confirmed. Preparing cardiac catheter. ETA in 20 minutes.
Die Telemedizin ist gerade für die Kardiologie deswegen so wichtig.
Telemedicine is so important, particularly in cardiology, because it enables us to timely recognize patients with a cardiac infarction and initialize the correct therapeutic measures, ultimately in order to treat them in a catheter lab, that is, reopening the affected coronary vessels.
Das heißt, ein Herzkranzgefäß wieder zu eröffnen.
Ich denke, das Besondere an dieser telemedizinischen Anbindung.
What makes this telemedical connection so special, in my opinion, is that it allows us to help those patients who are cut off from medical specialist care, like, for example, in infrastructurally underdeveloped rural regions, on ships or on organized trips and expeditions.
Reisen und Expeditionen. Wir sind wirklich sehr froh.
We are really glad that this patient has come through his severe heart attack basically without consequences. Without a doubt, this wouldn't have been possible without telemedical guidance, as we were able to immediately administer vital medication because of it. Without such a connection, this would only have been possible hours later, which might have considerably aggravated the patient's prognosis.
Ganz erheblich verschlechtert hätte.